Chronic diseases in the United States are a large issue affecting millions of people. Heart disease is one of the big ones that we think about most of the time. And then we also think about stroke and diabetes. And a lot of these chronic diseases are preventable. I was diagnosed with a rare form of cancer, but that really transformed my life and my viewpoint of what I want to do with my research. What I understood from going through that experience is how important nutrition is to your cancer recovery process. So we're really focused on understanding how nutrition and the gut microbiome interact together to produce different chemicals, to change how our cells work, and overall to prevent cancer from occurring or from metastasizing or getting worse. I'm really working hard to try to find answers for these cancer patients to prevent them going through the same miserable side effects that I had. I think Robbins College does a really great job in allowing us to collaborate across disciplines to really improve our ability to understand chronic diseases.
So my current research program focuses on how exercise benefit health. In the future, if we identify some protein or mitochondria or protein that can improve mitochondrial function, just like exercise does, we probably can synthesize those proteins for future exercise drug. I don't believe that exercise drug can replace physical activity, but perhaps certain supplements or molecules, when it is combined with exercise, maybe it can amplify the effects of exercise. For a certain population, like elderly or someone who has disability, who really cannot participate in the regular practice of physical exercise. I have the unique opportunity of interaction with undergraduate students, and they are very motivated and smart. So at Baylor, we have a lot of potential for the undergraduate education and in the STEM area.
When I was 16, I got diagnosed with type 1 diabetes, and I had known since very little that I wanted to go into medicine and healthcare, but I didn't necessarily understand why. It was just this calling that I felt. And then when I got diagnosed with type 1 diabetes, I was like, yes, there's my reason. That's why I want to do it. And for the longest time, I just wanted to be a physician and go to med school and help see patients. And it wasn't until I came to Baylor that I started to get introduced to research and meet awesome mentors like Dr. Park that were showing me there's more that you can do to help with type 1 diabetes than just see patients and just treat people. It is just such a privilege to know that God has put this on my life and has given me this calling. I feel so grateful that I don't really have to figure out what to do with the rest of my life because God's already told me.
In the Robbins College of Health and Human Sciences, we have expertise in healthy eating, physical activity, quality sleep, and even leisure and recreation. So we have all this expertise that can potentially collaborate to bring about impactful results and contribute to improve the health against chronic disease in the United States.